In what other sector would you allow an employee to carry on working without support after losing a colleague or losing multiple colleagues for that matter?
At the time of the global pandemic, COVID-19, I was working to complete the theory part of the nursing degree. However, made the decision to work as a healthcare assistant on the front line in order to be an extra pair of hands. As students, we work 11.5 hours a day and 37.5 hours a week. Many of us have additional employment. I know I used to manage about 64 hours a week.
As student nurses, this has been a very important and crucial time for us. As year ones, this is the start of our journey.
So sort of average day going into work, we have to go to work earlier than we normally would because we don't go to work in our uniform anymore. With the full PPE, we have to wear this respirator mask, which is really tight.
So for me, work in the past few weeks has been a bit bizarre. I didn't really appreciate how severe the situation was until our boss came in and said, look, we can't diagnose people with cancer. And we had to write letters and stuff, and letters were sent out to patients saying, I'm sorry, but we can't take your procedure any further, we can't diagnose you any further, we can't find out what the actual problem is because we just don't have the capacity for it.
Something I saw for the first time during this while working is withdrawal of care, sort of in lay terms, one might call it turning off the life support. In normal times, you'd expect the family would be with the patient, holding their hand, that kind of thing. Instead of that, we had to FaceTime the family, which was just horrible. You sat there holding the iPad while they watched from their home their loved one dying right in front of them. Myself and the nurse I was working with were there holding the patient's hand. You know, they weren't alone, but it just felt wrong on a human level.
I remember I found out one morning about John Alagos, who was a healthcare assistant working on one of the wards, and he was 23. I'm 21 years old, so he was only 2 years off me, and I found out that he passed away from coronavirus.
We lost a student on our course, Addy Raymond. He passed away as a result of COVID-19. He was in our year on the same journey as all of us. The same night that he passed, there's healthcare workers out there, you know, working on the front line without sufficient PPE.
Being a nurse is emotionally and physically very challenging.
We have learned about patience, teamwork and communication throughout this period.
But for me personally, seeing it at the hospital and generally seeing it over the last few years, even before this pandemic started, our NHS has been heavily underfunded. It's not their fault for a lack of service. They always do their best. It's actually a lack of funding.
There needs to be an understanding that claps aren't quite good enough, and what NHS workers need and key workers need is actually action, and understand that just because you don't work for the NHS doesn't mean that it is not your responsibility to question and make changes.
I hope that the kind of support that is being offered to nurses and other healthcare professionals at the moment carries on, because actually it's always needed.
Nursing is a profession I am extremely proud to be a part of. I don't have the words to do justice the incredible people that I work alongside. Incredible just doesn't cut it.
Becoming a nurse is such a privilege, and although I don't want to wish my life away and this experience away of being a student nurse, I cannot wait to become qualified, and I can't wait to every day of my working life to be alongside like-minded people, kind people, the best kind of people.
So I would like to finish by saying thank you to everyone I have worked alongside, to people I know and people I don't. I would also like to say Happy International Year of the Nurse and Midwife.
If this situation has done anything for me, it has confirmed that I love working for the NHS.